Good afternoon. How are you guys doing?
Good.
So far, so good.
How are you doing?
Good. Is the light okay?
Yeah,
You
like
can
good.
see the slide good? Okay, so in the syllabus, let me start by making sure you get this message. So in the syllabus, it says today we should be talking about pharmacology of the antiparasites in general, and then midchem of antiparasites. But as you know, I always combine them together because it makes more sense. So we'll talk about pharmacology and midchem of antiparasites. So we'll finish some part today and then another part next class, okay? But there will be a cutoff in today's lecture where I'm gonna tell you this is where it's gonna be part of exam one, and you know the second part would be in exam two. Make sense? So basically, um, what's going to be in exam one is the pharmacology and medchem of antihelminthic. So this materials that we'll start with today will be part of exam one, okay? And then the pharmacology and medchem of antiprotozoals will be in exam two. Make sense? Now, to avoid the confusion, if you look at the bright space, I have dated the antihelminthic by today's date, which is November 15, and then I have dated the anti protozoal on November 20th, just so you don't get confused. And I'll try to do the same thing with the recording, okay? So whatever you see dated for November 15 means that it's going to be in exam 1, and if it's dated under November 20, it would be in exam 2. Make sense, guys? Any questions? Any questions? Okay, so let's start by the anti-helminthic. So helminths general means you know worms, and we have three main groups of worms or helminths. These are the nematodes, trematodes, and cystodes. Okay, and so in today's class, we'll talk about the drugs that works on each one of these three drugs that works on nematodes, trematodes, and cystodes. And so you will have these classes of drugs as well as these classes of drugs and these classes of drugs. Okay? So I do expect you to know, the class, the classes of drugs or the example of drugs that works on each group of helminths. Make sense? Okay. Now, so these antihelminthics, or also known as anthelmintic drugs, they aim at the metabolic targets that are present in the parasites, but are absent in the host or human. Okay, so the goal is, for selectivity and specificity, those drugs will be targeting the metabolic pathways that are specific for the parasite, but they're not present in the human or the host, which makes sense because we're looking for something selective. Okay. Now, most of these agents act on eliminating the parasite, okay, as well as controlling the spread of the infection. So the goal is to eliminate the worm. As we'll see, some of these agents cause paralysis to these worms, so they're not able to stick to the human tissue, and then they will be excreted, basically. Okay. This figure here shows, just to give you an idea, of the different types of helminthic infections and their percentage of or how popular they are. So, for example, the ones in red are the nematodes, which are the most popular kind of helminthic infection. And then you have trematodes in blue, and then you have in green cystodes. Among the most common nematodes are these three: hookworms, Trichuris, and then Ascaris. Okay, so I mean, relatively, these are the top most famous. So this is just for your own information. we have to introduce some of this microbiology information so we can get to the pharmacology and medchem, okay? But I do not expect you to, I guess, memorize these names or know which one belongs to which. Make sense? But if I forget to highlight which part I expect you to know and which part I don't, just ask, okay? All right. So far, so good?
Yep.
Any questions? Okay. Now, of importance, especially to us as pharmacists, is the fact that those drugs among the list, albendazole, ivermectin, mebendazole, and thiabendazole, all these should be avoided in pregnancy. Okay, in fact, you would see many of these drugs that are used for antiparasites should be avoided in pregnancy. So I do expect you to know these, this list, because obviously this is very serious information that we should know by heart as pharmacists. So far, so good? Okay, so make sure you know this list by heart. Okay, to start with, we'll talk about the nematodes. So these nematodes are elongated ringworms that possess a complete digestive system. Okay, they cause infections mostly in the intestine as well as in the blood and tissues. And the figure on the right here again is just so you could be aware of what kinds of nematode infections we have. So these are the diseases that are common, that are caused by nematodes, and as well as the causative agent or the nematode, the name of the nematode that causes them. Again, this is not something that I expect you to know. This is microbiology. I think you might get to this into therapeutics. I think you might see these names, but I mean, for the purpose for pharmacology and medchem, I don't expect you to know, I guess, the names, the diseases, the worms, and then the spectrum of activity for the antibiotics. Okay, but let's just look at some of them because they have some interesting informations. Okay, so this one here is the onchocerciasis, also known as river blindness, common in these areas and characterized by subcutaneous nodules. These are some of the symptoms: skin rash, ocular lesions, often resulting in blindness. The drug of therapy for this disease is ivermectin. Let's see. There's also whipworm disease. There's hookworm disease. Pinworm disease. Let me see if there is some interesting information. So I think that's interesting about this one here, trichinosis. If you have uncooked, not insufficiently cooked meat, then you could result into something like this infection. What else? Okay, so this is, like I said, just a brief introduction so you could be aware of the helminthic infections. Okay, so now let's look at the drugs that act on them. So as far as nematodes, we have this list of medications that we're going to go through one by one and explain their mechanism of action. Okay, so the first one that acts on nematodes are mebendazole, and that's the structure of mebendazole. Now it belongs to a chemical class called benzimidazole. Can you tell from the structure where the benzimidazole? You guys might remember the antifungals when we talked about imidazoles and triazoles. Yes, Eric? Yep. So that's the imidazole, and that's the benz group. Okay? So if you see this group in any drug, you would know that it's a benzimidazole class. Make sense? And I would, so I do expect you, for example, to know which class this drug belongs to. Why? Because this functional group, the benzimidazole, will help us relate the drug to its mechanism of action. As we will see, all these imidazoles like benzimidazole, albendazole, and thiabendazole, they all have the same mechanism of action, and all of them will have the same, you know, category or the same class that they belong to, which is benzimidazole. Okay. So this drug is the first line agent for treatment of infections caused by woodworms, and pinworms, as well as hookworms and roundworms. Okay. So again, I don't expect you to know the spectrum of action for these drugs. Now, what's the mechanism of action of mebendazole, or in general the imidazoles? They inhibit the assembly of the microtubules. You guys might remember the cell division. At some point, it goes through where the microtubules have to pull the cells away from each other so they could divide, right? So by inhibiting the assembly of the microtubules, you're actually blocking the division of the cell. Make sense? Now, it also irreversibly blocks the glucose uptake. So it blocks the uptake of glucose, and so this worm will not have glucose and will not have energy. Make sense? Okay, so of course, anytime we talked about mechanism of action, we should make sure we know the mechanism of action for all these drugs. Okay? And so as a result, the affected parasites are expelled in the feces. Adverse effects of these drugs are abdominal pain, diarrhea, like nothing really unique as far as side effects. Should be avoided in pregnant women. We talked about this already. We have a list of drugs that should be avoided during pregnancy. Okay, and this is re-emphasizing the fact that many of these drugs should be avoided in pregnancy. Any questions about mebendazole? Yes, Eric.
It's more of like just parasites itself, right? But like specifically like worms, right? Like specifically like the nematodes that you said. Why is it that like, would you know, why is it that like it would mainly like infect like the intestinal area? Why not like any other parts of the body?
Okay, so the question is, why do nematodes only primarily affect the intestinal area? I'm honestly not sure. I mean, there's so much information in microbiology if you check helminths infection. I mean, each one of these kinds of infection and kinds of worms, they have their own stories of life cycle, and so I think it's outside of. But I don't know exactly why does it affect the intestine mostly. But it says, but it also affects not just intestines, the blood and the tissues. Okay, just keep that in mind. Okay. You're welcome. All right, the next one is thiabendazole. Again, if you look at the structure, you have the benzimidazole ring, so you could tell from that the class category, the chemical category of the drug, and you can tell its mechanism of action. We talked about mechanism of actions already for the imidazoles, so we're not going to cover it here. It's the same as the mebendazole. Just the only difference between this and the mebendazole, it's more used for topical treatment. Okay, so like superficial infections. So this could be applied topically. Because of its toxic effect, it has been largely replaced by other agents. It is toxic, so it's not the best choice, I guess. Okay, so that's all about the thiabendazole. Questions? Yes. Mebendazole is orally. Yes, it's only taken orally. Yes, thank you. Any other questions? Eric?
Is there something like in the structure that, like in the the bendazole, right?
Uh-huh.
Is this one more toxic than like the mebendazole?
Excellent. So in the structure, which part is making it more toxic? Well, I mean, the only unique part of the structure is this ring here. So, if I want to guess, I would say it's the one that's causing the toxic effect, okay? Because it's not present, obviously, in this mebendazole, for example. Okay?
Okay, got it. Thank you.
Sure. So far, so good. Okay. All right, the next example is the Pyrentyl pamoate, the third example. It's effective against infections caused by ringworm, pinworm, hookworms. It's poorly absorbed orally, so it actually acts on the intestinal tract. As we mentioned briefly, some of these worms, they actually infect the intestine, and so sometimes you want the drug to have poor absorption such that it could stay in the intestine and acts locally. Make sense? And that's the case with the Pyrentyl. It's poorly absorbed, so it affects the intestine tract, which where the worm present, is existing. Okay, mechanism of action. It actually causes. Let's skip this part for a second. It actually causes release of acetylcholine and inhibition of cholinesterase. So what happens when you increase the release of acetylcholine and you prevent the enzyme acetylcholinesterase? You guys remember acetylcholinesterase? Remember this enzyme? It's the enzyme responsible for degradation of acetylcholine. So you're increasing acetylcholine and you're also preventing the degradation of acetylcholine. What's going to happen? You would think too much acetylcholine, right? So you would think that should stimulate the cholinergic system more, right? Okay, well, guess what? If you have too much of acetylcholine, then you're actually preventing the receptor from going into the resting state before it could fire again, because the receptor has to go to activation and then resting and then activation again. Okay, so there is like an intermediate state called resting state where the receptor have to like reset itself and then be ready to be fired again. Ready to be activated again. So if you have too much acetylcholine, it's gonna bind to the receptor. Initially it's gonna stimulate it, but then it's gonna prevent its cycle. It's gonna prevent the acetylcholine from going back into the resting state and being active again. So you're actually blocking the activation process, so you're causing paralysis and neuromuscular blocking. Yes, question?
So does the mechanism become desensitized?
It's similar to this, exactly. That's the exact mechanism of desensitization. With the desensitization, if you're applying the drug more often, so some of the receptors become desensitized, they get stabilized into a certain state where they don't go back to the resting state, okay? But that's not the only mechanism for desensitization. Some of the mechanisms involve phosphorylation of the groups of the receptor where the receptor continue to be phosphorylated and never goes back to the dephosphorylation state, okay? So because of that, because of having too much acetylcholine and the fact that the receptors are not going back to the active form, so these drugs act as a neuromuscular blocking agents through depolarization of the receptors. And so this would cause paralysis to the skeletal muscles of the worm, and then it would release the worm from where it's attaching itself to the intestine. Now it's released and then it could go into the feces and would be expelled. Okay? Adverse effects are not so, unique. Nausea, vomiting, diarrhea, very common. And this is the structure of the Pyrentyl. In fact, this part here is the Pyrentyl, okay? And this part here is the pamoate. So you guys remember when we talked about having the salt formation of drugs? You always hear things like morphine sulfate, citalopram, hydrochloride, things like that. So this is just to make the drug in the salt form. Why? Because this one with the nitrogen groups here, it's positively charged. Okay, so we have to combine it with a group that's an acidic group with a negatively charged group to form the salt form, such that the drug could be formulated easily and then could dissolve easily. Okay, so the active form is the Pyrentyl, which is this part here to the left of the screen. Okay, the pamoate is just the salt form. So far so good? Yes, Eric?
I think, is there like a specific structure that kind of is able to, or maybe something to do with the structure, that specifically targets the worm and not us with the paralysis?
Part of the structure that targets the...
Like the hemlock or like the worm specifically and not us, because
I see.
dissociation.
Okay. So the question is, the question is about selectivity. What is it that makes this drug targets only the worm but not the human, right? Okay, so I'm not sure if its selectivity targets those acetylcholine receptors in the worm. I'm not sure if they're different, but one of the mechanisms, I mean, one of the explanations I can think of is that they actually never get absorbed. They stay in the intestine and then they act locally, okay?
Okay. All right. Thanks.
Sure. Yes.
Like piggyback on Eric's question, this all happens in the worm, like blocking the acetylcholine.
Yes, exactly. We were talking about the mechanisms of actions on the worm, yes.
Does it affect our acetylcholine?
Well, I'm sure it would affect and cause some side effects, but I mean, not to the point where it's like, could stop us from using the drug, okay? It's because the side effects here, nausea, vomiting, diarrhea, that's all, which is very common for most of drugs, right? Any other questions? Okay, so we talked about the structure, its mechanism of action, the fact that it's poorly absorbed, so it acts in the intestine, and the importance of having the salt formation, okay? All right, the next example is the ivermectin, okay, which is a drug of choice for treatment of these kinds of infections, okay? Which we're not gonna worry about, I guess, for our purpose. The mechanism of action of ivermectin, it acts as a glutamate on the glutamate gated chloride channel receptors. So you guys might remember the channel receptors. We have channels for chloride, we have channels for sodium, for potassium, right? So if you inhibit any of these channels, you're gonna disrupt the function of the cells. But of course, we're talking about the neuronal cells. In this case, it inhibits the glutamate channel, which is responsible for the transport of the chloride ion. And so it enhances the chloride influx, the entrance of the chloride into the cell, and it causes hyperpolarization. You might remember in the action potential, depolarization, repolarization, hyperpolarization. So when you hyperpolarize the nerve cells, they'll no longer be able to be activated easily, and that causes paralysis of the worm. Okay, because the action potential or the polarization has to achieve a certain threshold before it could, it carries on the signal. So if you hyperpolarize the cell, it can never reach to that action potential, and then you're basically preventing the action potential. You're paralyzing the nerve cells. Make sense?
Yeah.
Okay. Just like with the local anesthetics that works on the sodium and potassium channels, this is similar way, except it works on the chloride channel, the glutamate gated. This receptor binds to glutamate and then causes the influx of chloride. So the drug stimulates this receptor further, causes chloride to get in, and it increases the polarity difference, so it's hyperpolarization. Okay? Questions? Yes. So generally speaking, we always make the drug in the salt form to enhance its solubility. So we always like to make it in the salt positive negative form such that it could dissolve easily. It helps us also with formulations. When you formulate the drug, to precipitate it and collect it, so you make it in the salt form. And then when you administer it in the salt form, it's easy to dissolve in the gastric fluids, okay? And this is very common in many drugs. If you check most of the drugs, you would see always, something and then it's salt. Morphine sulfate, citalopram, hydrochloride, and things like that. Okay, sure. Other questions? Okay. Now there is something unique about one of these worms. By killing the microphilia of the onchocerciasis. You will have so much of these dead onchocerciasis microphilia that result in something called Mazzotti reaction. Okay, so this is unique with this drug because it acts on the microphilia of this worm, and so the accumulation of these dead worms result into something called Mazzotti reaction, which is characterized by fever, headache, dizziness, soreness, and hypotension. Okay. So the severity of this reaction depends on how much parasite you have in the body. So if you have a lot of parasites, the body is heavily infected by this parasite, and then when you administer this drug, the dead, bodies of this parasite is going to cause this thing known as Mazzotti reaction, which is characterized by these features. Okay. And how do we address this issue? You would give antihistamines or steroids, okay, to alleviate or minimize these symptoms. Okay. Make sense? Okay, so if you have too much of these worms, this special kind of worms, if you have high infection of these worms, then by taking ivermectin, it's going to kill so much of them. Now those dead parts of the worms are going to cause the Mazzotti reaction. You could eliminate or reduce these effects by giving antihistamine or steroids. Okay. Right. So this drug is given orally. It does not readily cross blood-brain barrier and should be avoided in pregnancy. We already talked about the list of drugs that should be avoided in pregnancy. Now this is the structure of the ivermectin. Okay. I mean, at the first sight, I would think this shouldn't be taken orally because it's a large molecule, but this might be one of the exceptions. Have I ever talked about Lipinski's rule of 5? Lipinski's rule for all oral drugs? Okay. So he has like a shortcut or thumb, like a rule of thumbs that you could look at the structure and tell if it could be taken orally. And so one of these thumbs, rule of thumbs, is the molecule size should be small. So this, there are exceptions, of course. So this would be one of the exceptions because it can be taken orally. Okay. So if I want to trick you, I would show the structure and say, can this be taken orally? And then based on your knowledge with Midchem, you would say no, and then it would be yes. And then I would be so mean, right? I would never do that. So far, so good. Questions? Yes, Eric.
Yeah, like, could you explain, like, why is it that, like, a big molecule like that can be taken orally?
Oh, so see, the molecular weight is one of the factors. The number of hydrogen bond donors, a number of hydrogen bond acceptors, and the number of single bonds, all of these factors play a role in whether a drug can be taken orally or not. Okay, so the shortest rule of thumb is looking at the size of the molecule, but you should take all these into consideration. Okay.
All right.
So I'm looking at that. I see too much like oxygens here. So many, I guess. Actually, the single bonds are not much. It's more like cyclic. So I mean, so it could be. I mean, but sometimes even when you apply all these rules, you still have exceptions where drugs can still be taken orally. Okay.
Okay, thank you.
Sure. So far, so good about ivermectin. All right. Okay, is that the last one, I think? Yeah, the last example on the list of drugs that act on the nematodes is diethyl carbamazepine. Diethyl carbamazepine, okay? Drug of choice for the filariasis caused by infection of the Wucheria, whatever that is. It kills microvilli and has activity against adult worms. In countries where filariasis is endemic, combination of anti-filary drugs such as diethyl carbamazepine and albendazole or ivermectin and albendazole may be used as a prevention chemotherapy. So, there is well, first of all, combining antibiotics is always good if you can, because you could increase efficiency of each, have synergistic effect, and you would minimize resistance and you would reduce side effects, okay? So you could apply this for treatments, and you could also apply it sometimes for prevention. You could take these medications as a preventive, as a way to prevent the disease from happening. If somebody is traveling to an area where there is a high chance of getting this infection, they could use the combination of these drugs as a prevention, okay? It's rapidly absorbed from oral administration with meals and excreted mainly in the urine. Adverse effects are fever, nausea, vomiting, arthralgia, headache. Can accelerate blindness and cause severe motility reactions in patients with the onchocerciasis. If you noticed, we were talking about the same filariasis that we talked about in the ivermectin, right? So it could also precipitate or cause the motility reactions, okay? Which could accelerate to blindness. I guess these reactions, if they are severe, it could cause to blindness, which is not mentioned here. Okay. So far, so good. Okay. So the take-home message is that this drug can also lead to the motility reactions, and it could be used in combination with other drugs for chemotherapy prevention. Any questions about this drug? Yes.
It's not really much about the drug, but like you said that like the diethylcarbamazine, right? This one's really good for like places where it has like the most amount of like adult worms on there. But do you know which specific places actually have like the highest prevalence of worms?
Which places?
Like which places, like which countries?
Oh,
specific areas?
I'm not sure, to be honest.
Okay.
Yeah, but was it in the first slide here? Because I think they talked about the areas as well.
Oh, okay.
Yeah, so they talked about some of the areas where this, not all of them, but for some, they mentioned like the filariasis, but they did not say where. Yeah,
I think it's all the way at the top. I think I saw it all the way at the top.
I think it was just the first one they mentioned that it's in these areas. Okay.
Okay, thank you.
Sure. Now, I do remember in retail, we used to have, like, people who are traveling, they would even start, I think, a week or 2 weeks before they travel, they start on these medications just in case, so they don't get the infection. Yes, ma'am. Oh, so we don't have the mechanism of action. Many of these, or as you will see with the antiprotozoal, sometimes we don't know the mechanism of action of that drug. Okay, so I could probably dig and see if we have the mechanism of action for that. My guess is that we don't know the mechanism of action, but we could find if it and find its mechanism of action. We will see this in protozoal in next lecture. You would see a lot of drugs that have, it's believed to have this mechanism of action, but we don't know the exact mechanism of action. Okay. This is actually true for a good amount of drugs, because clinically, if you see the drug doing its job and not have so many side effects, we could just continue to use it even if we don't have its mechanism of action. Okay. So far, so good. Okay. All right. So these are the ones that works on nematodes. Next are the trematodes. Right, so trematodes are known as flukes. They are leaf-shaped flatworm that are generally characterized by the tissue they infect, such as the liver, lung, intestine, and blood. So the nematodes were infecting the intestine, blood, and what was it? Tissues. But here we have the blood, intestine, but we have also liver and lungs. Okay. All right. And just like with the trematodes, we have diseases and the kind of forms that are caused, and then some information about them. So this is for your own information. Let's see if there is something interesting to share. So this disease is transmitted by eating raw crab meat, okay, which is this one here. Clonoriasis. Eating raw, raw fresh water fish. So most of the time it's eating something that's not cooked very well, right? So now from now on, anyway, anytime you go to the restaurant, make sure it's well done, right? What else? Yeah, that's a good point. Should switch to sticks. Anyway, okay. And I think we only have one drug that acts on this trematodes, which is the praziquantel. Okay, so it's the agent of choice for treating all forms of schistosomiasis, whatever that is, cystode infections such as teniasis. Used off-label in treatment of cysticercosis. Permeability of the cell membrane to calcium is increased. So that's the mechanism of action for the praziquantel. I guess that's the take-home message. So it increases permeability of the cell membrane to the calcium, causing contracture and paralysis of the parasites. Okay. This drug should be taken with food and should not be chewed due to having a bitter taste. It's rapidly absorbed after oral administration. It distributes to the cerebrospinal fluid, which means it crosses the blood-brain barrier. Extensively metabolized, and the inactive metabolite excreted into the urine. So what does that tell us? I mean, not to memorize it, but when you say something when you know something gets extensively metabolized by the liver and mostly excreted in the urine, this means if you have kidney problems or liver problems, you should definitely do something about it, adjust the dose, okay? Adverse effect, dizziness, malaise, headache, GI upset. These drugs may increase the metabolism of the drug. So this is a drug-drug interaction, okay? So we have drugs that induce the metabolism, and we have drugs that could cause increase in the level of the of its level by drug-drug interactions. So you don't have to memorize which drugs affect the metabolism, but just understand the concepts. If I want to test you, I would test the concept. I would tell you, for example, this drug is metabolized by enzyme X. Another drug enhances or induces or inhibits enzyme X. What happens if you combine them? Okay. No, don't. Okay. Contraindicated for treatment of ocular because destruction of this organism in the eye might cause irreversible damage. So I guess this infection of the ocular this drug should not be used because the destruction of the organism could cause irreversible damage to the eye. Okay, just an information to know. And that's the structure of the praziquantel. You don't have to memorize the structure, of course. So really the take-home message is just the mechanism of action, and the others are just concepts that if you understand, you'll be able to apply them not just to this drug, but to any drug, okay? Yes? Oh, this one? No. Okay. From this slide? Really, nothing really, I mean. This is microbiology, and just to help us jump start into the topic, because we have to say something about the nematodes, or Any other questions? Okay. All right. So the next class are actually the cystodes. Okay. So they're actually tapeworms. Typically have flat, segmented body. attached to the host intestine. Okay, like trematodes, the tapeworms lack a mouth and a digestive tract through their life cycle. So I think the nematodes are the ones that has a complete digestive system. The cystodes and trematodes, they do not have a mouth and digestive system. Right, so these are the diseases that are caused by the cystodes and the worms that will cause them. They also talk about the therapy, of course, but you don't have to know memorize the broad spectrum, the spectrum of activity, sorry. Let's see if there is any interesting information. I don't see any really. Anyway. Okay. All right. So drugs that act on the cystodes. The first one is niclosamide. Okay. This one is actually no longer available in the States. There is an alternative to that, which is praziquantel for treatment of these cases. Its mechanism of action is by inhibiting the mitochondrial phosphorylation of the adenosine diphosphate. So you guys, you know the importance of phosphorylation of the adenosine diphosphate into triphosphate and how that could be incorporated into all the kinds of activities like giving energy. So if you inhibit this, then you're actually blocking the all these important reactions. A laxative is administered prior to oral administration to purge the bowel of all dead segments to enhance the digestion and liberation. So this drug is gonna, I guess, prevent, it's gonna kill these cystodes, but then to stimulate the release of these cystodes from the intestine, you would administer it with a laxative, okay? Alcohol should be avoided within 1 day of using of the niclosamide. And that's the structure of the drug. I wonder why alcohol should be avoided. All right, any questions about that? Yes?
If they don't have a digestive tract or like a mouth, then how does it survive? Like, they would just die on its own.
Oh, well, I mean, just like, for example, bacteria or fungi, they have their own ways of transporting nutrients inside. So, you know, the nematodes were unique because they have a complete digestive tract, like a mouth and the like GI tract, okay? But that's the way they survive. But the other ones don't, but they have their own ways of getting nutrients absorbed, okay? Yes, Eric?
Why is this something that you need to, like, why is this a medication that you need to get the laxative with versus the other ones where you don't?
That's a good point. So the question, why does this require laxative, the others don't? I'm not 100% sure, but I think maybe because mostly these drugs or these agents infect the intestine. But we have seen also other ones that infect the intestine.
Yeah.
So conceptually, it should be applied to all of them. But again, that's when you have a concept, but then you apply it clinically, you see if it's efficient. It might be efficient for one case, but not the other. Okay.
All right, thanks.
So, but I don't have an explanation. Sorry.
No, it's okay. Sometimes it's just strange.
Sure.
Just that way.
Yeah. But it's a good. It makes sense. Any questions? Okay. I think we have 2 more drugs and then, last drug. Okay, so albendazole, which class of drug does this belong to? It's imidazole and benz, so that's a benzimidazole, okay? And we already talked about mechanism of action of all the benzimidazoles, okay? So these are the areas, I guess, spectrum of activity. Absorbed from the oral administration, but absorption is enhanced with high-fat meal, distributes widely into the cerebrospinal fluid, so which tells us it crosses the blood-brain barrier. undergoes extensive first-pass metabolism, including formation of active sulfoxide, which means it produces an active metabolite. Okay. Albendazole and its metabolites are primarily excreted in the bile, so it's not in the urine. So if somebody has yes, like any liver problems, then we should adjust the dose. If they have kidney problems, we would not do anything because it's not eliminated in the kidney, right? It's mostly eliminated in the bile. Okay. When used in short course therapy, 1 to 3 days, for infestation, adverse effects are mild and transient, including headache and nausea. If they are used for, I guess, long term, you would have hepatotoxicity and rarely agranulocytosis or pancytopenia. Treatment is associated with inflammatory response to dying parasites in CNS, including headache. Medication of is associated with inflammatory responses of dying. Okay, so the dying parasite could also cause inflammatory responses in the CNS, including headache, fever, and seizures, just like we've seen with the other parasites. So the take-home message is recognize that this is benzimidazole, which means you have to know its mechanism of action. The rest are concepts that are applied generally to all drugs, okay? Because I don't expect you to memorize where each drug is metabolized and excreted, okay? And we talked about all these at the beginning that should be avoided in pregnancy, right? So albendazole was one of them, even though we did not say it here, but we know that it's one of the drugs should be avoided in pregnancy. Yes? You don't have to memorize how each drug is metabolized and where it's cleared. Correct. Okay. Any questions? Okay, so this would be the cutoff materials that are included in exam 1. Okay, so let's stop and have a break, 10 minutes, and then come back and talk about the next chapter. Okay, all right, so we'll be back. Let's come back at 4:01.